Hello and welcome back. I'm Eric Sunset, your host of the DocBuddy Journal. Here at DocBuddy, we deliver healthcare solutions that take the pain and costs out of broken workflows, like with OpNote, which gives ASCs and their affiliated clinics the power of instantly generated operative reports approved from the point of care. You can learn more about those and all of our software solutions at DocBuddy.com. And I'm pleased to welcome back Tim Burney, the CEO and founder of Advantien, to the DocBuddy Journal. Thanks for joining us today, Tim.
Yeah, thanks, Eric. It's great to be back.
And it's not just a normal welcome back. I'm welcoming you back as we are now officially partnered together. So that's huge news for those in the ASC space. Couldn't be more excited about that.
Well, I share that excitement with you. I tell you what, this is it. It's just such a natural fit for I think our two teams, and I'm excited to more efficiently, more effectively deliver sort of solutions to the ASC space. All of our partners, all of our customers, I should say, ASC customers. So looking forward to working with you and partnering with the whole team on the DocBuddy side.
Oh, same here. And it's such a natural fit. We talked about this a little bit before recording, but tremendous headwinds for those in facilities across the country. You can hardly retain staff, let alone hire them. And what we both do is remove the burden of these administrative tasks, streamline your operation with a legitimate digital workflow that just hasn't been available before. So I think that's really important to point out.
Yeah, I agree with you. I mean, when you look at the rising, I mean, the lower reimbursements that are coming in as reimbursements go down, as you look at that, combined with the challenge of ASCs finding employees for us, materials managers, right? I mean, they're challenged to find materials managers. So any opportunity that we have, and we focus on this, and I know DocBuddy does too, is how do we remove a lot of those sort of everyday tasks that become burdensome, that pull those people away from direct patient care, and we're both focused on that. And one of the things I'm so excited about this partnership, like any partnership, foundationally you got to kind of have some alignment, and I think for sure foundationally we have that alignment. We look at data analytics as a tool on driving efficiencies, cost savings, et cetera, and data analytics, AI, et cetera. How do we help those surgery centers, the materials managers, the nurse clinicians, et cetera, the surgeons, become more efficient so that they don't have to focus on those administrative duties, that they have up to this point. And we're both aligned in that way. And that's really exciting, right? So I'm looking forward to kind of moving that ball forward. The other thing is, while our offering is focused in the ASC space, it's not overlapping or redundant. It's sort of complementary to each other, right? So that's exciting as well. So as we talk to our, ASC customers, it's exciting to be able to talk about DocBuddy, and what DocBuddy does, which is an exciting, menu of solutions for the ASC space. So we're excited about this whole partnership.
Yeah, same here. That sentiment is shared from the top to the bottom of DocBuddy. And if you'll allow me to wax philosophical for just a second here,
Yeah.
that you have these ASCs that are forced to do more with less staffing than they've ever had. And as you are well aware, and our audience is well aware, the classic healthcare fix is just hire somebody. Throw some FTEs at it. We'll sort it out manually. It doesn't matter. We'll just hire somebody. But now you can't. You can't just hire somebody. So that certainly presents a challenge for all of our friends in the ASC. I think it's more of an opportunity than a challenge, because you get the opportunity now that you may not like that you can't hire FTEs at will or full-time equivalents at will, but now you're almost forced to look at digital solutions, at software that makes a meaningful impact for the facility, where maybe in the past you would just add headcount and increase your salary burden or payroll burden for the organization, but now you're forced to look at different avenues. And I think that's actually a really positive, despite the short-term challenges that may present.
Well, Eric, yeah, that's a great point. And not only hiring people, but hiring people that maybe have the broad array of talent that is required in a specific role. I'm not saying there's very talented people in the ASC space, but my point is as this business continues to become more complex, leaning on data. How do we get the data? How do we assess the data? What does this data mean? Because at the end of the day, while, people can be afraid of data, it actually makes their jobs easier if it's used in the right way, right? And so we look at it as whether you can't find the right person to hire for a particular job, whether it's materials manager, whatever it is, or you need to sort of fill in some gaps, let's say, of expertise in certain areas. To be able to do that for the ASCs is very meaningful, right? I mean, when we work with ASCs and we talk about data, those ASCs who are not collecting data, don't know what their data is, don't know how to analyze it, know what it means, are falling way behind. And so this is really an opportunity. I mean, you look at it, these headwinds, and yeah, they're scary, but there are some solutions. And I think both DocBuddy and Advantien offer those solutions, along with other companies who are out there using data analytics. I think that's where you really drive these solutions. And actually, it's an opportunity to get better, I think. And it's an opportunity to get more efficient. And when you look at the different tools that are available to ASCs, if they take advantage of these tools, and I'm talking specifically about, how do we collect our data? What does it mean? How do we compile it? How do we analyze it? How can we maybe drive better reimbursements based on the data? How can we identify areas where maybe we drive down costs? Things like that. That's where I think the data is so powerful. And so when we look at all these headwinds, they're scary, but I think there's solutions out there. I know there's solutions out there that can actually, increase the opportunities for ASCs to get better.
Big time. Yeah. And obviously, we want to have a link in our show notes to our joint press release. We'll be sure that's something you can take a look at. Tim's got a great quote in there. Our DocBuddy CEO's got a great quote as well. And some information about how to learn more we'll include in the show notes as well. And I want to turn our eye towards some trends on in the supply cost space, Tim. We're 17 days into Q4 here, and everybody knows the end of the year goes by really quickly once you just about hit Halloween. But I know one of the things our listeners will be keen to hear about is supply cost trends through this year, what you've seen on the Advantien side, and maybe even what to expect going into 2025.
Yeah, well, I think supply costs, like all costs, right, continue to rise. I don't think there's any sort of secret in that. You see different numbers on that. Depends on exactly what you're talking about. You can go to the extreme, you know, um, uh, you know, when we look at some of the implants that we look at, because the cases are moving from the hospitals to the surgery centers, that has not driven down the cost. You would think the more you use, maybe there's an opportunity there to drive down the cost, and there are. But the reality is those supply chain costs continue to go up, whether it's implants, whether it's K wires or drill bits or whatever it is. All those prices continue to go up, and don't really see any end in sight. I mean, uh, on the device side, device companies are historically have always raised their prices every year, 8 to 10% in January. Sometimes, that'll vary every year, 2 years, depending upon contracts and things like that. But I think we can expect to continue to see prices go up. And again, reimbursements are not going up, so that is a challenge for ASCs. And so, how do you deal with that?
This might be a little bit of a curveball, but you can't escape it. We're obviously in an election year. We're 3 weeks away at the time of recording from November 5th, I think that it is. Is there any variance in election year supply cost changes or trends versus non-presidential election years?
To my knowledge, the answer is no. I wouldn't be the expert on that, but I will tell you that, historically, I don't see that. What I see is a lot of uncertainty, right, in everything, right? No matter who you talk to, what is this going to mean? And I think that's probably the biggest thing in hesitancy and maybe purchasing capital equipment or whatever the case might be. But I can't draw a correlation between costs going up or not based on that or more or less. But I can tell you that, again, costs are going up as they historically have, and particularly in today's environment where all costs are going up. Supply chains are all along the supply chain. Suppliers are driving costs up. So expect the cost to go up. I mean, that's just the bottom line, right? It's just a question of what do you do about it.
Yeah, well, and that's a really nice segue. Obviously, a lot of headwinds, a lot of uncertainty now, 3 weeks out
Right.
from an election, maybe some hesitancy to act. But with all that in mind, I don't think that means freeze your spending and don't do anything. There's got to be some type of opportunity baked into these challenges and into the uncertainty. So, what are you seeing the really high performing surgery centers do despite all of these variables?
Yeah, well, I talked about data earlier, and I'll continue to talk about it because it's such a valuable leveraging tool for ASCs. So as I mentioned a moment ago, as we see more and more, we focus on orthopedic cases mostly, but as we see more and more orthopedic cases going from the hospital to the ASC, that presents an opportunity, right? So you're talking about volume going to the ASC. For those higher performing ASCs, they're taking advantage of that volume. They're looking at their data and they're talking to their surgeons and saying, hey, listen, are you willing to go either sole source or dual source, for example, to help drive down our implant costs? We're going to have these discussions with the reps. Here's the data to show that, our usage is going up. So, we want to see an offset in the cost of our implants. But the key to that is, and what the high performing ASCs do, is they look beyond their P&L and their balance sheets and in other words, on their P&L, they'll look, okay, we're making money or we're not making, whatever the case might be. They're doing things. We have what's called a profitability roadmap. And those ASCs who are using either their own tool or something like the profitability roadmap are looking at per cost or per case costs. In other words, you look at the cost per patient, you look at the cost per payer, you look at the cost per procedure, and that is a separate sort of P&L, if you will, right? So it's a more detailed P&L that gives you an idea. Number one, you can run the analysis, and we do this. We use AI to help us with this tool, but you run this analysis, and you can identify some trends. For example, it might be a surgeon that's doing a rotator cuff procedure compared to another surgeon, and one surgeon is making money and the other isn't. Is it the payer? Is it the cost of the implants that they're using? What is it? And by drilling down at that, if it's the cost of the implants, then you use that as leverage to go to the device company and point out, look, we're losing money on this particular case. If you help us by, helping us control our costs on this particular procedure, that will make a difference to us, and it'll also help us not have to look elsewhere to use some other, device companies, implants. So that is one opportunity to do that. Same with reimbursements, right? I mean, you look at it and maybe it's consistent with one payer that they're paying, I don't know, I'll make up numbers, $1,000, $2,000 less on a particular procedure. And if they would just reimburse a little bit higher, it would make that procedure more cost effective. And when you think about that, an ASC compared to a hospital, right? We all know that an ASC is the place to have a procedure done if you're a patient. The quality of care, the cost, et cetera, is superior to a hospital. So, and the reimbursement that the payers pay is about a third of what they pay hospitals. So you would think that payer probably wants to keep that procedure in the ASC. So in other words, the higher performing ASCs are looking at those more detailed numbers to determine where there are opportunities to drive down costs, maybe increased reimbursements by negotiating specifically about specific cases. And so at the end of the day, it's really, again, the high performing ASCs are leveraging the data that they're collecting, and they're doing it in a very effective way where you can have meaningful conversations with the stakeholders, the surgeons, the device companies, and the payers to deliver the most cost-effective and the best quality patient care.
And you alluded to this a little bit earlier there around economies of scale, either single source provider or dual source provider for implants and supplies. We had a guest on not too long ago that had a great phrase here that more can scale. You can certainly get economies of scale if you can whittle down your supplier list, but something different that doesn't scale because it's new. It's different, whether that's a new surgeon or a new procedure that you want to perform at your ASC. What's the word to the wise there where you're going to embark on a new type of procedure or with a new surgeon where maybe you don't have data, you don't have comps yet?
So I had this conversation actually just yesterday. Someone asked me, we have a couple of de novo surgery centers. Should we wait until we start doing cases where we have volume to then negotiate, or should we negotiate up front? My answer is negotiate up front. Look, over time, if volume increases to a point where you go, okay, this price no longer makes sense because we've increased volume by whatever, 40% or whatever it is, then fine, then renegotiate. Maybe don't lock yourself into a long-term contract up front, but definitely negotiate those prices up front. I mean, look, device companies are competitive with one another. There's a lot of sort of commoditization in the market, although you won't hear that from the device companies. And there are specific implants that are unique. But having said that, there's still an opportunity to negotiate aggressive pricing, even up front, whether it's a de novo or whether it's like you just said, Eric, where you've got a new surgeon or a new procedure. It's important to do that up front. If you don't, what's going to happen is you're going to, and I know all the people out there who run ASCs or involved with ASCs know this, you're going to get some list price or some high price on some implant that's going to blow you away. And depending upon your payer, it's going to matter to your bottom line. So anyway, bottom line is negotiate that up front. My recommendation would be, and I gave this recommendation yesterday, is that let's get this pricing in place up front. If your volume increases significantly, we'll renegotiate the pricing.
Yeah, that's a good word to the wise there, and you certainly don't want it to be adversarial. You're going to be partnering with the vendor, the payer, whoever over the long term, hopefully, and have a great relationship with them. But something as simple as, I think you can sell it to me for less, and I'd like you to sell it for me for less, is a great way to open that conversation.
Yeah, and Eric, I mean, and I didn't touch on this, but device companies, obviously want your business, and they'll be reasonable. I mean, it's just a matter of sort of, again, I hate to keep throwing this out, but data, right? Keep discussing, because even though it might be a new implant or whatever supplied to the ASC, doesn't mean it's new to the market, right? So there's numbers out there to sort of support some sort of pricing in almost every case. And the reality is, if you go to the device companies with, a good reasoning why you want to do it, you provide that to the surgeon, and you have a good conversation, they will partner with you. And will you come down to the lowest price? Whatever. You'll come to some price that's better than what it would have been had you not at least had the discussion.
Yeah,
So
you got to ask.
You got to go there.
And that conversation around data is really interesting. And I think we touched on this the last time we were on the show together. It depends really heavily on who you ask with regard to EHR implementation at a surgery center. So more than just your practice management, your scheduling, your patient accounts, your billing, but actually having the clinical record, whether that's integrated in with your PM from the same vendor or even a separate vendor. The vendors say it's about 50% penetration into their PM, their practice management software base, that have an EHR as well. My personal opinion is that it's a little bit lower than that, probably closer to a third or maybe approaching 40%, because adoption is continuing. Mm-hmm. This is a really long walk for a short drink of water, Tim, but you're mentioning data. You don't necessarily need to have the EHR and the PM to be collecting the type of data you need to support these pricing conversations with your vendors and with your payers, do you?
No, I mean, as far as let's talk supplies. I mean, implants specifically, which we work with. What we do is we collect data from the case on. So we've got data, and then for a specific ASC, but then you compare that against benchmarking, right? There's plenty of benchmarking databases out there. We happen to have a very robust one that we compare data that is coming in, regularly, and we call it weeding the garden. So as upfront, you look at what is the historical purchase of, what are you purchasing, what are you paying for it, how much are you using, those sorts of things. You throw those variables into an analytics tool, and it basically, not as simple as this, but spits out, right, where the opportunities are to drive down costs. How does it know that? Well, it compares it against some benchmarking, database to determine that. So a lot of the data is out there. You take your internal data and compare it to some external benchmarking data, and it'll give you a pretty good idea of where you could be. Could you be more aggressive? Maybe, but at least it'll give you a starting point to start having discussions. So that is available out there as well.
Well, when a facility works with somebody like Advantien and your team, there's sort of three levels to data. At least this is how it's been explained to me. You have the just raw data, so think about a big spreadsheet, and we know from experience, the literacy and even creating a pivot table can be really tough. I don't know how to do that. I'm overwhelmed. There's too many columns, too many rows, and I just can't do it. Then you have information, where maybe somebody has cleaned that data, or you mentioned it, weeding the garden. You've cleaned it up a little bit. You can start to see some trends, but again, not everybody's capable of either doing that or understanding that. But then that third layer is where everybody can understand it, and that's insights. So you don't necessarily need like a data scientist to help you through this process if you have the right partner to get to those insights.
Yeah, that's right. I mean, look, um, it's so I struggle with the same things. I mean, I've got a person on our team that's an expert in pivot tables and all that kind of stuff. My eyes glaze over as soon as I hear about it because I don't understand it. I admit it. I just don't understand it. So for me, if you sit down and start going through all these things and flipping around and that, I kind of get lost at some point, right? And I think a lot of people do. So, you know, for again, for Advantien and some other companies out there, whether they're consultants or whatever, to automate those things is really important. And again, integration of AI right there is one area where I think AI can be valuable, right? To do a cursory, if nothing else, a cursory overview of all of the data that you have. So as I mentioned earlier, a specific P&L tool to analyze specific cases, is an example of that, right? So a tool where you can look at everything, the payers, the surgeons, the patients, and all of that. And then we use AI to do a cursory glance at what are the opportunities here. First of all, where are we losing money? Where are we making money? Where's the comparative analysis on what it is that's driving these losses or these gains? And then, sitting down and then just looking at that analysis. You don't have to look at all the numbers until you look at the analysis. And then from there, you can go back and examine the numbers. So it can be a daunting task, but you know what? We've tried to make it simple. I think we have. And I think that, again, regardless, you've got to leverage the data. You've got to look at that. And you asked earlier about high performing ASCs versus others. And that's really, to me, what I see is the big difference. They understand. I mean, can you imagine doing any business, your business, my business, any business out there outside of medicine, where we don't understand all of our costs? We don't understand our supply costs. We don't understand where the money's coming in. We don't understand where it's going out. You would be out of business. And unfortunately, that happens sometimes with ASCs. But to sort of say, well, we don't have it and sort of, that's okay. Well, we all kind of know it's not okay, right? And it's really not that hard to get into a position where you do understand your data, and it frees you up. I mean, the fear of what you don't know, you can take you under, right? The fear of what you don't know could be the difference between making money and not making money on a case or in your ASC or whatever the case might be. So having the opportunity to really analyze that, and those opportunities are out there, whether it's with Advantien or whoever, there's opportunities out there to analyze data, to look at the analytics, and to make good business decisions that will actually raise your ASC to the higher level. And it's not that difficult to do.
No, and what I find really fascinating about this type of analysis is that the longer you have gone between analytics sessions, I guess, for lack of a better term, the bigger the surprise might be. You'll have numbers screaming off the page or off the screen at you, and you're going, what? I had no idea. And without the analysis, you would still have never known. But as you get more and more in tune with your data, and it's not such a long period between reviewing your insights, the surprises lessen, but that doesn't mean they're still not there. There's still opportunity to improve, even if it's not at 50%, just to make up a number. Maybe it's only 15%, but that's still a big difference for an ASC.
It is a big difference, absolutely. And I'll tell you something else as we look at all of this. It's really moving manual processes to more automated processes, right? I mean, and there are opportunities. Look at DocBuddy, the things that the processes that you impact that used to be all manual, that took the people away from the administrators, the docs, everybody, the clinicians away from patient care to focus on things that are administrative, and you have to focus on administrative things, but can you automate those so that they're more user friendly, one, but they also, instead of taking up that time to do those functions, they're done for you, right? And all you have to do then is to look at the result. That's all you have to do really, is to look at the result. Obviously, over time, you have to make sure the data is accurate and that sort of thing, but someone else could do that for you as well. But the bottom line is that as we look at these processes around data, it's really, to me, about automating processes, functions within the ASC space for the administrators and the clinicians and surgeons to offload all this busy work. And by the way, as I said earlier, it's really an opportunity. It's an opportunity to say, hey, it used to be okay to have paper POs. It used to be okay to do all these other sorts, or paper POs are fine, but track it on paper and that sort of thing. But we really need to get these things centralized. We really need to sort of get into the future, if you will, where we take advantage of what's out there. And by the way, at the end of the day, the cost for those things really are minimal or less than having to have your staff take time away from their patient care to deal with these things, or to pay overtime, or whatever the case might be. So there's solutions out there, and I would say to you that those centers that are taking advantage of the automation tools that are available to them to collect data, to analyze data, to make good decisions, to offload work from their folks, are doing better. They're more profitable. I'll just say it's a general statement: more profitable, and they're just running a better system at their ASCs.
Well, I want to phrase this the right way, but when things could be better, and whether you're at an ASC or at any other type of business, if things could be better, but they're not, because you're not looking at your data, you're not understanding the mechanics of how you make money, which, we don't want to lose sight of patient care, but you need to make money to provide patient care.
Yeah.
They're not as good as they could be because you tolerate them, or you turn a blind eye to them, and it's a level of acceptance somewhere in there. But now with this, we've already talked about the staffing shortages and all the headwinds ASCs face. You're not in a position to tolerate these shortcomings anymore. And how exciting for you that there are data insights and there are workflow improvements that you, having used the new way, whether that's with Advantien or DocBuddy or even an EHR for your ASC, you
Right.
would never go back to doing things the old way. It would be insane.
Yeah, that's right. And the other thing I'll throw out as I was listening to what you just said, which is so true, is that sometimes there's the fear of, what does this mean to me or my job? The reality is, what we're talking about really makes your job better, more efficient, right? And what I mean by that, there are people that may feel a bit challenged by what we're talking about, right? Am I going to lose my job as a result of this? The answer is, not because of this, right? Because the reality is what we're talking about is how do you become more efficient? How do you be able to focus on the patient care? You mentioned cost and patient care. Around all of this is obviously patient care, right? I mean, we're all talking about the same thing. How do we partner with our ASC customers, our partners, and help them become more efficient, cost effective, et cetera, to deliver the best patient care, right? How do they deliver the best patient care? By being profitable, that is one way you do deliver the best patient care. You don't have to cut corners, not that they would, but you don't have to do things not knowing what's going on. Maybe it frees up some spending that you didn't know you had, or whatever the case might be. But the bottom line is efficiencies actually do, and profitability actually does drive better patient care for many different reasons.
And to go back to something you said a little bit ago around using AI to deliver some of the insights, I want to hear a little bit more about that. What are some of those screaming off the page, sort of weed the garden, AI first
Yeah.
pass into data that you've seen for clients?
Yeah, well, so weeding the garden. What I mean by that is it's an ongoing process, right? So if we look at data up front and we go, well, okay, here, based on your data and what you use, here are your opportunities for savings, right? But ongoing, some of those prices can fall out. Either a rep makes a mistake and enters a wrong price, or brings in a new product you mentioned earlier, right? That wasn't approved, or wasn't that get a pricing approval up front type of thing that falls out. That's what I'm talking about with weeding the garden. But when we look at these things ongoing, what AI, when I mentioned AI for us, we use the profitability tool to assess, as I mentioned, each case that's done in that center, and that comes through central invoicing, which is an important part of this too, where we collect all the data. But by having all that data, you build these individual P&Ls for all the cases. The AI then identifies, as I said earlier, hey, this payer for this particular case with this particular procedure and surgeon, you're losing money, and this one you're making money. So it identifies those sort of areas. And by the way, we don't, at Advantien, we don't just lean on the AI as the end all be all, but it is a very effective, efficient tool to give us a sort of idea of what's going on. And then we look at it, humans look at it to make sure, hey, does this really check? And it's surprising how much it actually does. It's almost scary how much it does. But nevertheless, we make sure that that analysis, those summaries are accurate. But it gives you a real view of opportunities, as I said earlier, to look at, can we talk to the payer and maybe negotiate for these particular procedures an increase in reimbursement? Can we talk to the device company and talk about for this particular implant maybe a decrease in cost so that we can do these cases here? And our experience is, and it varies, but our experience is that you'll have a willing office or a willing audience, excuse me, to listen to you because, after all, the ASC's health is also, to their health and their business as well. So they want to do right by the ASC.
Well, I'm curious on this point, Tim. I know it's practical. Like you could technically achieve that individualized case P&L if you had somebody that could work on it long enough. What's the manpower, the time savings that the AI tool delivers that maybe an ASC could never do that, just not having the people?
Yeah, so good question. So the compiling the information to make sure that it's accurate is one piece, right? There's fixed and variable costs that you've got to look at. A lot of that is in the ASC's P&L. And then that which isn't in there, for example, implant costs may be in the HST or one of the other CIS or something in one of those databases, or we may have it in our database if you're a customer. But we input all that information, and for us, we do it. But an ASC could do it. They just have to make sure that they're pulling all that information into a separate sort of database, a case costing, a profitability roadmap sort of database where they compile it all together. And then from there, that's where all of it begins, right? The numbers are crunched. So what AI does is it just shortens the time to analyze all that information, right? You mentioned earlier, Excel or whatever. That takes a long time, right? You can do all the stuff that I don't know how to do, that experts do, and come up with that. But I happen to know, and that it takes hours, days to do that. What AI does is it shortens that time to minutes. And as I said earlier, then we can go in and look at that and spend an hour or two and confirm whatever the AI has to say about that, right? So the reality is, an ASC can do it. They can do it on their own, no doubt about it. It'll take a little longer, a little more manpower and that sort of thing, but ASCs can do that without AI, and so either way, we just find it just saves us time. That's the bottom line for us, and it's pretty accurate, but we verify that.
And I would imagine that if you're doing them on a monthly basis for the preceding month's cases, that's probably a week's worth of work. And you start on Monday, it'll be done on Friday if you don't work on it every second of the day. And then, by the way, you've got another month's worth of cases coming in a week or 10 days. It sounds impractical.
Yeah, it's hard. It's very hard for ASCs to do it on their own, but they can, and I would say to you that the hardest part is getting the initial sort of download of data, right? Because making sure everything's correct. And from there, you sort of, you build in some things. You only have to go back a month or a quarter or whatever the case might be. That's an area where we collect data on an every case procedure. So ours is constantly updating. And so it doesn't require that intense labor time, that you're talking about. So it depends on what you choose, but you can do it on your own. Certainly we do it, and we update it constantly, which is a real benefit. So it just depends on how you want to do it.
I gotcha. And on the topic of AI, just sort of in general for healthcare, what are you most excited about? What are you seeing?
I'm honestly excited about, well, a lot of things. I sit around with my team a lot, and I do a lot of pie in the sky stuff, and I know they get frustrated with it because I don't know anything about AI except for what I see, and checking my emails, see if I could write an email better or something, whatever the case might be. And I always do write an email better with AI than I do on my own. So that's kind of scary. But, as I said, the analytics part of it to me, because I see it in action not every day, but as we use it, I see it in action, and it's very, very effective. I know at DocBuddy, you have some use for AI, and I think there are spots where it fits. I don't know, long term, you sort of look at it as I talk to people. There are people who, are coming around to it. I'm just one of those people that, sort of sees it and watches, different things taking place. My experiences, I told you, with our profitability tool, and it works. But, beyond that, it's sort of, for me, it's sort of, how could we use this? And I'm seeing healthcare. I mean, you see more and more in healthcare, inventory management, tools, all sorts of different things that AI is applicable. But I'm a guy that just sort of dreams about things, quite frankly, and then I leave it up to the people that know more about it to tell me, why we can or can't do it. I think over time, though, it's become an integral part of healthcare. I really do. Don't you?
Yeah, I do, and I think it's been interesting to see healthcare embrace it with open arms. Now, you talk about pie in the sky. There are some big time dreamers that are predicting at some point in the future, which from my point of view would be a really long time away, the outright replacement of providers. I'm not sure I agree with that.
Yeah.
I would view it more sort of in the cliche sense now at the end of 2024 that AI is there to help workers, whether you're a doctor or guys like us or whatever. It's not going to replace people, but those that refuse to adapt AI into their workflows where it can save them time and give them efficiency, they'll be replaced just because they don't perform as well as everybody else using AI.
Yeah, well, I agree with that for sure. It's like I said earlier. Fear of the change, I think, is way overplayed in most people's minds, because I think used appropriately and properly, in my mind, kind of like our business and sort of supporting ASCs in their implant business, get good pricing, et cetera, is really just to kind of remove, as we talked about a couple of times, both teams, right? DocBuddy and Advantien. How do we take away, those burdensome duties that you do every day that just take you away from patient care? And I think AI and other things can help do that, right? Can help achieve those things. I don't think it'll replace people either. People will replace themselves if they don't do their job or inefficient, et cetera, as you mentioned. But I think that the bottom line is that, what we're talking about, it really is, how do we enhance the delivery of patient care? How do we make this more profitable, less costly, more efficient across the board? And to me, ideally, that's what AI is. I don't know where it's going to go, of course, neither one of us do, but to me, that is the use for AI. And that's what I look for within, for example, our business and the ASC space, is how do we utilize these different tools to make us more efficient, to make our partners more efficient, so that they can do the things we talk about, focus on patient care, and be more efficient, make more money, et cetera. So that's where I see it.
I'm with you wholeheartedly, and I'll add just one thing that right now, the state of the art, like really the decision you have to make, and I see people on both sides of this where they're skeptical, they don't want to touch it, and then I see the other end where people want as much AI as they can get, where maybe you don't actually need it. But right now, the trade-off you have to keep in mind is if I use this AI tool for whatever process I'm completing, will it take me more time to do it myself, and I know that the output's going to be right? Or will it take more time to review the AI generated outputs? And that's
Yeah.
the balance. Which one is more time saving? Which one's more effective for me? It requires less brain power. Like you mentioned, writing emails, end of the day, maybe it's late, you want to get to inbox 0 or whatever your number is. Like, man,
Yeah.
AI, whip me up a reply on this one. It's going to
Yeah.
take me longer to type it because I'm already brain dead from the day. So that's the balance that I think people are starting to see. And as it improves, as AI gets better and these models get more accurate in their outputs, the balance is going to differ there. I don't know what that balance will be in the future state, but we're not there yet.
We're so early in this thing. It's going to be fun. I think I'm excited about it, just because I like new things, and I like new things that drive efficiencies, et cetera. And I see this as one of those solutions. I'm sure there'll be starts and stops in different areas and that sort of thing. But I'm really excited for healthcare, because whether it's AI, data analytics, and AI, I think are the combination there to help drive the things we're talking about, make it better for everybody in the ASC space, make it better for the people that work there, make their lives happier, just, all those sorts of things. Happy sounds like, yeah, whatever. No, it's real. I mean, you know how it is. You go to work and you're not looking at, oh my God, I got to do all this stuff that has nothing to do with what I was trained to do. I'm a nurse, I'm a doctor, I'm a materials manager. To be able to offload that really does make a mental difference. I see it all the time. I mean, for our customers who don't have to deal with a lot of things they had to deal with before, that we've offloaded for them, it's meaningful. And I think AI is a way to make that happen. you nor I know exactly where it's going to go, obviously, but I think there's a lot of opportunity to be a lot of fun watching it as we kind of move through this.
Yeah, I've got my popcorn ready, and I do know one place where Advantien is going in the coming weeks, which is the Ohio State Association of ASCs. That's in a couple of weeks, if I'm not mistaken.
Yeah,
DocBuddy won't be at that one, but you can find us on sort of the flip side of this. We'll be at Becker's ASC and the Washington ASC show coming up. So you got a couple of opportunities to meet the Advantien and DocBuddy teams before the end of the year, before the end of trade show season. So
absolutely.
everybody attending those and managing those will be glad that 2024 is in the books in just a couple short weeks.
Yeah, for sure. I'm from just a little aside. I grew up in Ohio, Lancaster, Ohio, to be exact, 30 miles southeast of Columbus. And gosh, I actually was there a couple of years ago just for a quick meeting, but haven't spent much time back there. I have a lot of fun memories. Ohio's a beautiful place, and we're certainly looking forward to spending some time there. There's some real opportunities, I think, to kind of have some good discussions around that. Yeah, and anybody that happens to be at that uh, conference, please stop by and see us. And Becker's, as you said, you'll be there. That's a big one. That's always a fun one to attend. So, yeah, good opportunity there. We'd love to see anybody happens to stop by.
Yep, find us on the show floors at those events. And if you're not traveling through the rest of the year, Tim, where can folks connect with you online?
Yeah, well, www.advantien.com is a good place to sort of, it gives an overview of what we do. I mean, we'll detail some areas. I talked about the profitability roadmap. There's a real nice video on there, 10-minute video that kind of walks through that and how it works. And there's some other things on there about our RFP processes and some other things that we offer. I'd love to have people visit there. My personal email, feel free to reach out to me, tburney@advantien.com. That's ADVANTIEN.com. I'd love to hear from anybody. If you have any questions, we'd love to talk to you.
We'll get all of those links into the show notes as usual. And on behalf of the entire DocBuddy team, I want to thank you for listening. Tim, thank you for joining us.
Thanks,
And
Eric. It's always fun to sit and chat with you.
you get a standing invite. Come back anytime.
Thanks, buddy. I appreciate it.
And until then, audience, be sure you're subscribed on Apple Podcasts, Spotify, and YouTube so you always get the newest episodes of the show. And until then, we'll talk to you next time. I'm your host, Eric.